This is an important survey to HIMSS and honestly our greater nursing informatics community. So we're building on research that began in 2004. And this survey continues to show how the nurse informaticist plays a crucial role in healthcare. So particularly in the last few years as we've been embracing and adopting and advancing the findings of the Future of Nursing report, we've now presented ourselves with a unique opportunity to recognize the importance of leadership and innovation amongst the nursing informatics workforce. So I'm aware where I'm at ANIA. Many, if not all of you, are seasoned nursing informatics professionals, so you might be thinking I'm preaching to the choir. Well, I get it, and yes, in some ways I probably am, but however, with your wealth of knowledge and being present with one another and gathered in this room, our goal through this survey and through our dialogue here is to perhaps offer up one nugget of information, one data point or one spark of innovation or inspiration that you can carry back to your organizations and truly be prepared to unleash at that absolutely right moment, right? It's those unexpected moments that if you're prepared for it can certainly ignite and spark something pretty impactful and start some change. So while you may be familiar with what we might discuss, I really invite you to keep an open mind for that one nugget that could make all the difference in maybe your next presentation, your next big idea, or your next project. So I wanted to share a little bit about the methodology of the survey. As I said, we've run this survey since 2004. And I do have to look at some notes because there's numbers and I'm absolutely not memorizing numbers. So for this survey, we had 1,128 valid respondents that provided information about their current positions and their career trajectories. And this is not the exact survey from 2004. We obviously, over time, and so much change that has taken place, we've had to adjust the questions to also represent the continued growth and development and changes within the workforce. But this survey that we did and released in 2022 was the first post-COVID, first one that we had run post-COVID, post-pandemic. It was distributed to HIMSS members and also our HIMSS collaborators that are listed here, and we specifically wanted to thank ANIA for their continued support in also distributing their survey to their constituents. Anyone in this room remember taking the survey? Yay, thank you, thank you, thank you. Nudge the ones next to you, there's another one coming up soon. And I know those surveys can sometimes be daunting, but the more we can collect, the more we can help articulate and tell the story and find those pieces of information to help inspire some change in the workforce. But the rest of my part of this presentation, I've just pulled a few highlights to discuss based on the survey responses. Obviously can only share what and interpret the data that we've collected, but hopefully we find something exciting. Okay, so again, I do have to look because there are numbers, and I know it's charts, and it might not be as easy to see, especially those in the back of the room that didn't want our front row Taylor Swift tickets. Hospital and health systems are remaining the most common primary workplace for the nurse informaticists that we've been able to capture through our survey and reach through our distribution, and that number is 62%, so that's from our respondents. What we initially saw what we saw in 2020 was the growth primarily within the ambulatory workspace and setting. And this year, where we saw the growth was through the ancillary healthcare providers. This is the first time that they've actually, that category has made it into the actual report. Prior to that, that had not been reported on any of our, on our survey categories. Also, we saw a slight jump in the long-term care, up about 3%. Certainly you can interpret that how you might know some of your colleagues and their movement in the workforce, and some of the other data slides will show that. Many more opportunities, more interconnectivity, more interoperability, more needs, obviously everything EHR. More specifically within the long-term care, we also attribute that to the need for the quality regulatory reporting also, and having to advance having some nurse informaticist roles within that space. Okay, I'm not doing that, just so you know. That's, didn't touch the thing. don't know what's happening. So hopefully this stays still because I know there's a lot of information there. So I know this is a pretty big slide, lots of numbers. We wanted to show some of the comparable data over the years. The nursing informatics specialist remains at the most common title that we've been able to document it at 17%. That's now followed by clinical informatics specialist at 12%, and showing that that title is becoming a little bit more prevalent. We always have a lot of interest in this job title slide. Obviously, there's growth and understanding of this role, and it's becoming more diverse and specialized, and we're finding that that's really based on the organizational culture and need. There is a significant difference every year that we run the survey within the layers that don't make it to this top slide, seeing sometimes upwards of 80 write-in titles of varying differential, making up their own titles, let's just say. And so it really doesn't always fit the exact buckets that we put up as our choices. And again, trying to attribute it to the wide variety of titles that are able to be filled within this specialty, and how each organization can really design a position and a title based on their individual needs. But last time we ran the survey, prior to this one, was early 2020. Well, the data was released in early 2020, so all of that was collected pre-pandemic. The significant increase at that time was within the director and manager level. So we attribute that and thought that that was probably the ability for the organizations to create fuller and more robust nursing informatics teams, so that it wasn't just one or two core individuals running the department, but they were able to really build up a solid team and structure. But this year, when we saw this significant increase in the clinical informatics specialists, we've been talking about this a lot and believe, of course, there could be attributed to a few factors, and you probably have some of your own ideas as to what that might be related to. But it potentially, the broader scope of the typical boundaries of what a nurse informaticist does. During the course of your day, the interdisciplinary approach to informatics, maybe collaborating with other departments more so, expanding the work to work with physicians and pharmacists. But I will say that it's brought a great deal of attention to the issue of taking the word nursing out of the title, and a lot of concerns with that. Obviously, having nurse in the title really speaks to the specialty, and having that nursing knowledge and not losing that identity that is specific to the nursing profession to bring to the title, to ensure that the nurse's voice and their understanding, their experience, their backgrounds, and their clinical experience really is brought to the forefront. So we've been having a lot of discussions to continue to advocate to keep the nursing in the title. So we really looked at some of those other categories that don't really make it here to see how they've been dispersed and sort of sprinkling in words here and there, but are advocating really to keep nursing in that title. How am I doing? Okay, not bad. Okay, so here's in their current role. The tenure in the roles are continuing to increase, but really the message on this slide that we wanted to note is that there may not look to be a large bench of nurse informaticists, and really thinking on how to encourage more nurses at their right time to enter into the field.